Name is Tech Sergeant Michael Jones. I am a surgical tech over at Travis Air Force Base, and I'm a part of the 349th MDS. The LAMAT team that I'm a part of, we're here in St. Lucia, and what we're doing is we're providing needed care and to build multinational relationships with the locals, and to learn how they do things, and vice versa, show them how we do things, and provide whatever help or assistance that their patient population needs. What inspired me to join this team is that I saw that as like a really good opportunity to, go to another country and do my job there, and to help people that may or otherwise would not be able to get this care, and just making just making a positive impact on them, and making the United States look good in the process. As a surgical tech, our job here is to make sure our team has all the sterile supplies that they need to be able to do the cases, make sure we have the sterile instrumentation, having it ready in the room, open, ready to go, functioning, and be able to help the surgeon in the use of it, and keeping track of like the sterility of the fields, and making sure all of our counts for our countable items, are good. We integrated by, we came in like a day earlier before we started going. We introduced ourselves, told us our roles, we learned their roles, and we pretty much communicated that we're not here to teach you guys or show you guys how to do things. We're here to work with you, learn how to do your things here, and to work as a team to accomplish that, and help the population here that needs it. Probably the biggest challenge really is just not having a lot of the items that we're more accustomed to providing the type of care that we're really used to. And here you kind of have to be creative. You have to learn their processes, which is why it's imperative that we work with them, because we may or not know how to properly do the job without their know-how and the way they make things work here. My initial thought reaction was like, wow. I just never thought I'd be doing surgery in like a sports stadium. I was really curious what it looked like inside. And I was really surprised when I came inside to where it was like really well thought out, how they made it work for them to do this as a hospital. They really, it's been impressive how they made that happen. I adapted simply just by talking to the locals here, and just having them teach me how they do things, and being open-minded and attentive, and following and then doing what they showed me to do. So actually it was pretty easy, because the staff here has been really good. I guess we were able to do turnovers very quickly here. We were able to do a lot of surgeries back to back really fast, versus like some places over back in the States. Turnovers for surgeries tend to be a bit longer. I guess there's just different protocols there for one various reason or another. So I was actually kind of surprised that we actually did as many as we did in the short amount of time that we did them. A lot of patients had issues that I guess would be considered more elective. And when they came in, it looked almost more emergent, because they either couldn't afford it, or they just couldn't get access to it without like the LAMAT team coming here and allowing that to be done. So some of these people really needed surgery. So I'm glad that we were able to do that. One or two things I'll take back from this trip is I guess just maybe like gratitude and being able to make an impact on some of the people's lives here, because a lot of them really needed the care that they received while we were here. And if we weren't here, then many of them would probably continue to suffer, may not be able to work or support their families. And I'm hoping that all these people will be able to get back to their normal day-to-day lives, and be better off from what we were able to do here. Yeah, that patient, he was in an accident. He had multiple fractures. The open fracture was the one that we were worried about, which, because since it's open, it's contaminated. And so we just made sure we cleaned it out really good. And we'll be seeing him in possibly a week to make sure that it's not infected or getting worse. And then from there, they'll put implants in to permanently fixate it. Right there, I was providing a lot of traction on the fracture to where it will stay reduced, so he can fixate it the best he could and clean it out. And yeah, I was just mainly providing a lot of traction, just keeping the site clean, giving the instrument he wanted when he needed it, and until it was done being cleaned, and then they put a cast around it, and they'll be assessing the wound next week to see if they can put implants in or not. I'd say a benefit for our team is that it should make us more flexible in the future if we're ever like deployed on a time where we're like more austere environment where we have to like kind of like put on our thinking caps and think outside the box and make things happen. And I guess for the people here, I think the benefit is that we're able to bring a lot of new supplies here for them to use, a little bit of equipment that will hopefully allow them for months and months to use on their patients to help them get their procedures done that they need to happen. The good thing about cross collaboration like that is it just makes you overall better. You get to learn new ways of doing things. It makes you more open-minded in the future to working in different scenarios. And vice versa, they learn some things that we do, and then they can adapt any of those if they want them. And just while I've been here, I've just been doing my best to do things exactly how they do it. And I'll take pieces here and there to apply to a trade that I do back in the States when I do this job.